Welcome to CEO Money. I'm Michael Yorba. Thanks for joining us. I have James Segermark, President and CEO of InSitu Biologics, on the show with me today. James, welcome.
Great, thank you. Glad to be here.
I just love your company. I love your deal. It's, to me, it's going to be earth-shattering as time goes forward. Let me back up a little bit. Let's talk about what your company does, because it's going to change the way the world works, and then dive into some of the other topics I have for you today.
Absolutely. So what we do is we produce a matrix, we call it the matrix biohydrogel. It's a completely biocompatible compound, much like the consistency right now of honey, but we can vary that consistency and implant it in the body. Now, why would you do that? Because inside of that we can put drugs, stem cells, monoclonal antibodies. Down the road we look to treat rheumatoid arthritis. We can go after cancer tumors. I'm reading about John McCain and his glioblastoma and how they're saying it might take 20 drugs simultaneously to shrink that tumor because it acts like a velociraptor. We believe our matrix is something that could be surrounded around a tumor, put around a knee, and with the right drug compounds, reduce or eliminate pain completely, or maybe shrink a tumor to zero. It's a cool technology, and kudos to the Cleveland Clinic Foundation for originally thinking of it and compounding it to the point where they could prove some concept back in the early 2000s. It was like alchemy. Imagine taking three things found in nature and creating a jelly that the body does not recognize as a foreign body. You put this in the body just leaves it alone.
Give me the story of how you got here.
I started actually working on this product in 2007. But how I got to what I do, I am a medical device / biotech entrepreneur. Got into medical right out of college, worked for Xerox, did some training, but then my entire life, once I saw the need for devices and products to reduce the complications created by surgery or by procedures, I started working with doctors and making products. I have over 40 plus patents. I've started numerous companies. I do look for an early exit on the product. I don't fall in love with the product because it has to get to the people. If it doesn't get to the people, it's useless. A lot of people like to build kingdoms and pay themselves lots of money. We like to see it get to the market. So through that, met some people, and folks that had licensed this product from Cleveland Clinic. I was brought in to look and see, can we make a business out of this? Because they had started to make it. And originally it was for bulking. It was to get rid of the creases in our head like Juvederm. They were looking at incontinence. They were looking to bulk up the heart to keep valves from leaking. But then the scientist, Bill Taylor, put some blue water in it. And over the course of 7 days, he was able to draw the same color of blue off the water. It was slowly degrading, or slowly eluting water. And that's when we said, this isn't a bulking agent. This is a delivery system. Right. It's like a non-pulsatile organ because the body doesn't reject it. So we can tune it. We can make it last for 15 minutes, 15 days, 15 weeks. So it all depends how thick it is and the combination of the three compounds.
Well, the thing that blew my mind is right here on the front part of your homepage of your website. It says a new opioid-free painkiller.
Right. I mean, that's the first and most obvious need for this country. And, frankly, it is the United States problem right now. We're not reading about an opioid epidemic anywhere else. Pain is handled in a different way in different countries. We're quick with the pills. We're very generous with the pills. So it wasn't by design that we anticipated an opioid crisis. It was that we were looking for a better way because of the complications being created in managing pain. And that was mainly from pumps. Because post-surgical procedures, still 95% have a pump with a catheter tunneled into their body, and then they squeeze the drug off to themselves. Well, that catheter can occlude, it can grow in, it can have all kinds of issues, it can move. And that is truly the gold standard for immediate post-surgical care. So that's what we were looking at, and then boom, Exparel from Pacira. They got clearance from the FDA. It's a good product, but it's a first-generation product, and as we all know, the second, third, and fourth generations are really where it's at. So The pathways are being created, and hopefully we can help with this unfortunate crisis that is going to take decades. Only now, and I'm on LinkedIn, the first hospital to change from an opioid-based painkiller for uterine hysteroscopy occurred last week. Indiana University, they're no longer using opiates. Now, imagine what that took for the administration to say, okay, we'll go. But if a woman has pain, she's not going to get the opiate. And they took out 1,400 pills already in 1 week. Wow. 1,400 pills.
Tell me about the capital raise, what's going on with it, the Reg A, and what you're doing forward with that, the business side of this thing.
Yep, so we opened up the Reg A July 17th. We got qualified by the SEC at a price of $5.75. We could raise up to $10 million. Within the first 8 days, we closed over $1 million. We had nearly two in reservations. 1.6 ended up coming in within a couple weeks, and we stopped that price tier at $5.75. We went back into the SEC and made a case as to why it should be at $6.85, and that's where we're at today. We have our quarterly filings. We have some big milestones ahead of us. We have one final GLP preclinical test that's going to start in October. And that will be a driver of many different things. A phase 1 clinical study will be the result of that, as well as a few other things that strategically we're not necessarily talking about publicly. But we are optimistic that we have a lot of demand for the stock, a lot of interest. Our investors are very well heeled. At this point, they tend to be on the higher, more accredited still, even in the Reg A. We do have some smaller investors, and we want everybody. And I take every call, every text, every email. I personally will respond. But we have some people coming in with some very healthy investments, anywhere from $50,000 to $250,000 at this time. So,
let's move forward about what these people are expecting. I know you can't get too into detail about forward-looking statements on the show, but you can certainly talk about the investors making money on InSitu Biologics down the road, because this is monumental. Yeah.
So our plan, we already touched on the fact that the matrix can be used for many applications. We intend to complete our phase 1 study and then look to the market. We will most likely have an investment banker on board in the beginning of 2019 and start to talk with strategic partners. We did explore that a year and a half ago with Benjamin F. Edwards. We talked to all the big companies. No one said no. They all said, go put it in people. Prove to us that it works, and then knock on our door. So now we're not looking to sell our company. We're looking to license that asset, AnestaGel, that we will have created. Now, as comparables, Pacira makes Exparel. They have a market cap of over $2 billion. Heron Therapeutics has a product that's not even cleared by the FDA. They have a market cap of $3 billion. The market is $90 billion a year in treating post-surgical pain in the U.S. alone. Our market cap is $30 million today. So we anticipate that when we have a transaction, that money would be paid out and distributed to our shareholders in the form of a special dividend as they occur. Again, when we start phase 1 in Q2 of 2019, we'll finish in Q2 2019. Our scientists are done. The product's handed over to the clinical research organization, and we're working on the next product. So we believe we can do this for a very, very long time.
I believe you can too. Speaking of that, is there any thing that I should say what could be next coming down the road that you want to bring out today?
We haven't, we've played with a few things, but certainly the biggest markets are where we want to impact. In rheumatoid arthritis, monoclonal antibodies for cancer therapy. There are a lot of heart-tugging orphan diseases, but again, the economics of making something that costs, hundreds of thousands of dollars per kilo to make our product and explore it, you do have to get a return. So I would say large markets and those that are not being served today by long-term sustained release drugs, epidural procedures. Imagine if we could put something in like an onion that slowly layers, helps them immediately, and then drops pellets over 30 days, 45. Maybe we could get to 60 days with a single treatment. Maybe we could get to 90 in time. and control the flow of drugs during that time. It's sustained release. You're not having to pop other pills if a doctor gives you an injection and it releases over 90 days, or start at 30. Call us a failure if we do 30. It'd be great.
Got it. All right, James, thanks for being a guest on the show.
You bet. Thank you.
My pleasure. You've been watching CEO Money with Michael Yorba. Don't forget, like us on Facebook, follow us on Twitter, and subscribe to our YouTube channel.